Ladies and gentlemen, please welcome NASW President, Dr. Mitt Joyner.
Good morning, everyone. Oh my goodness, your week you were all at the party, but my mother used to say when you party, you gotta have the same excitement in the morning that you did at your last dance. So good morning, everyone. Good morning. Welcome to the third day of the 2022 NASW National Conference. You are joining more than 1,000 social workers from around the United States and even few from abroad. We also have many people joining us virtually. Please continue to engage our fellow social workers and followers on social media. Use the hashtag NASW2022. Now I say that for our communications department because they're able to like what you say, and we want to fill the pages on Twitter, everywhere, to let people know we're here. We're here when actually a bill got passed last night for on gun violence, and so it's going to be voted on by the House. So we're bringing some progress. We might have, it's a duck walk, 3 forward, 2 back, but I'm sure it's because of our pressure that we had and they saw in Twitterland. The social workers are in here today. You know, yesterday's program was amazing, especially the call to action that social workers are still needed to be, the moral consciousness of America. We were given a new task by Reverend Barber, and I hope you're ready to join the Poor People's Campaign as social workers and go home and talk about exactly what he described yesterday, that the world is calling out for our skills. And we hope you enjoyed all of those breakout sessions and last night's film festival. And oh my gosh, a night with NASW. Wasn't it a great night? So this session today is more important than ever for social workers because we're going to talk to you a little bit more about how to get involved in public policy. Everything that we talked about ends up in that one box called the ballot box. So before you go home, we want to give you strategies. We want to get you excited about how your role is to go back and talk with your students, your colleagues, those you work with, your family, and your friends. Everyone that you touch, to talk about the issues, not about whether it's blue or red, but the issues that we are going to be confronting in very, very soon. We have a wonderful plenary session this morning from Christa Butts, is the Director of Public Policy at NASW. And she's going to talk to you about how the association, NASW, is advocating for the profession and the clients that we serve. I know we get tired doing that all the time, but what did Reverend Barbara tell us yesterday? Tired means we just have to get up and do it the next day, right? Tired is actually our self-care because we're doing it and we're making sure we're getting the message out. And later, an election forecast. I really want you to listen and take notes when Julia Shura, I always mess up her last name because I call her Julia, but she's a social worker first, and Alan Wheat from the Wheat-Schroyer Government Relation Firm. They will have studies which show how social workers play a critical and vital role in the delivery of healthcare services in the United States. So take notes when they speak. And that is why we're also glad to have a keynote speech today from Admiral Rachel Levin, the Assistant United States Secretary of Health. But Admiral Levin was the person that I in Pennsylvania woke up every day and listened to as she gave us the news about COVID and how Pennsylvania was going. And Pennsylvania stayed low and our community stayed low, and we owe so much to Admiral Levin. And we'll have more breakout sessions to you to choose from, so kind of figure out where you're going. One is going to be talking about helping social workers better access the risk of suicide prevention. That number is trending up in America, and we need to understand, also have the strategies, but protect ourselves as we begin sometimes to feel hopeless, alone, with no choices. We could not have brought a wonderful program without all of the following sponsors. But first, I want to tell you to stop by the exhibit hall, not only to get your coffee and your donuts, but also to walk, because those individuals are the ones that kind of helped us get here. So get your swag bag filled, go and talk with them. They would love to engage with you. I would also like to thank Brightline, One Circle Foundation, NASW Insurance, Expedient Case Management, North Central University, Pacific Oaks College and Children's School, North Carolina State University, Columbia University School of Social Work, ECINS, Howard University School of Social Work, the University of North Carolina, Greensburg, the University of Pennsylvania School of Social Policy and Social Practice, also known as SP2, and lastly, the organization Find Help. So I would like to thank you for joining us at NASW, and we're going to have a special event this evening, NASW and the NASW Foundation. The event honors leaders whose work has uplifted individuals and families and communities and helped shape the course of history. So it's not too late to attend. Visit the registration desk for more information, but please try to come to a night to remember this evening. Now, in every organization, you have a wonderful CEO who has a staff. So I decided that I will not introduce Sarah Butts to you, but I would reintroduce to you our CEO, who will have the pleasure of introducing one of his key staff members. Angelo Mclean.
Good morning, everybody. It's good to see you. Glad you chose to be with us this morning. Hopefully you were able to go and get your dance on last night, or your TikTok, or whatever that was spinning around us. And then saw some of you in the gym this morning. You're probably thinking, okay, Wednesday was really good, Thursday was really good, okay, there's going to be a drop-off. No, there's not going to be any drop-off today. We got more exciting and really good things planned for you. A friend of mine just came over and said, you know, the happiest I've ever seen you was yesterday after Reverend Barber spoke. And I said, well, I think it's because he just touches our soul and touches our heart. And I was just so happy thinking about, how the profession is going to come together and live out the things that we talk about in terms of our values and principles. And I just got excited thinking about the wonderful things that we're going to do collectively together. It's my pleasure to introduce to you Sarah Christa Butts. And Sarah is the Director of Policy. I think the title is Public Policy for the National Association of Social Workers. Sarah does a terrific job. A lot of the work she does, it's behind the scenes. It's making relationships. It's meeting with congressional members. It's meeting with officials within the administration. It's meeting with key staff members. It's a whole lot of legwork and background work that sometimes doesn't get recognized. But then the fruits of it are things like getting telehealth, support for telehealth, getting telehealth extended. We, NASW, haven't taken full credit, but when you think about audio-only telehealth, it would not have happened without NASW really pushing the needle on that, and really being a thorn in the side of CMS, and Sarah was obviously critical in that. But a lot of work goes on behind the scenes, and Sarah will give you a little bit of a glimpse behind the curtain today. In addition to leading our public policy work, she also does fundraising for our political action PACE. She is, I'll tell you a little bit about her background. Before she came to NASW, she was executive director, and probably should say founding administrator of the Social Work Grand Challenges. And those Grand Challenges was a part of the American Association of Social Work and Social Welfare. How many of you, show of hands, have heard of the Grand Challenges? Oh, good. There's many of you in the room. If you've not heard of the Social Work Grand Challenges, just Google that and look at those 13 Grand Challenges that we're taking on as a profession. So Sarah was at the Grand Challenges. Before that, she was special assistant to the dean of, that's Rick Barth of the University of Maryland School of Social Work. She's the recipient of the 2018 Daily Records 40 Under 40 VIP List Award. She's contributing author of the 2018 Oxford University Press book, Grand Challenges with Social Work and Society. And I know she did a lot of legwork to make sure that book got published. And she also did a lot of legwork to make sure the second edition of the Grand Challenges got published. She is a board member of the Congressional Research Institute for Social Work and Policy, better known as CRISP, and she brings her energy to that. She's got a master's degree, and she's a licensed master's social worker in Maryland, I believe it is. I think the thing I should say about Sarah before I ask her to come up, and you can start coming up, Sarah, is she brings her energy and her excitement to the task every day, and she's always building relationships and leveraging those relationships. And I do want to say that her work extends not only at the national level, but with the chapters. And we have a number of our chapter EDs and chapter presidents here, and the relationships that they have with Sarah. So a lot of what I said about Sarah, doing all this work at the national level, is also happening at the statewide level. I give to you, Sarah Christa Butts.
Thank you. Thank you, Angelo. Well, you all, it's such a pleasure to be here. I can't tell you what it feels like to experience this pandemic and then find myself in a room with over 1,000 social workers at this conference. It's just amazing. We spent so much time working to get here and to make sure we actually could get here in person and to provide an opportunity on virtual that I think I forgot how wonderful it would be to be with all of you. So very glad that you're here and that we can be together. So I'm going to talk about social work advocacy and public policy this morning. What I'm really going to try to do is talk a little bit about the social work profession and our work in public policy. NASW's policy portfolio, also the state of play in Washington, D.C., kind of what's happening. And in D.C., what's happening changes in a minute sometimes. Sometimes it's a couple weeks. So I'm going to give you a sense of what that looks like. I'm going to try to demystify the policy process. I've always been a macro social worker since I graduated with my MSW, and I wish that I was privy to this presentation early in my career, so I'm going to try to provide that for you all today. And give you some examples of what I think are progress or success that we've had. And I do want to say that this is an NASW presentation, but there will be times when I'm going to share some of my opinions that are based on my experience doing this work, and also working for political appointees, frankly. I came up in state and local government and then went to work in the university system in higher ed, and before I did this work on the Hill. So I really struggled to figure out how to begin this presentation, and I just decided that I wanted to say thank you. Thank you to our CEO, Angelo Mclean, for leading the association and our profession at such a critical period for some time. Thank you to our president, Mitt Joyner, for her tireless advocacy and the energy that she brings to the social justice issues that we care so deeply about. Thank you to all of you. I feel it's a great privilege to have this job that I have, and I take it really seriously. So thank you. Also to the members, our members that have been members of the association for 20, 30, 40 years. We literally cannot do this work without you. And I'm going to make the case that it is NASW that needs to do this work for us moving forward. There is not another organization outside of CSWE that works in partnership with us that's really lobbying on our behalf, especially at the federal level, and increasingly, I mean, we're seeing attacks at the state level. So we've always been active, but this is a critical period. So if I could just set the stage, I want to be clear that this is not a theoretical presentation. This is actually a presentation about the application of policy practice. And I think it's helpful to understand what is the context that we understand in public policy. And they are, the social context. What is happening in society? And we know what's happening, all kind of chaos. It seems that every social justice issue we care about is kind of in flux at this time. The economic context. Do we have money? Or are we thriving? Or are we just surviving? Is there a surplus? Is there a deficit in government? What is the spending situation? The impacts that these high gas prices are having and inflation. The political context. Who's in power? We have a friendly administration right now with the Biden administration. When I came into this position 3.5 years ago, we were in the Trump administration. We were completely on the defense from a policy standpoint. We were literally, we wrote a letter, NASW did, to the federal government asking them to please not strip non-discrimination protections from the ACA. These are like wins that were hard fought. I don't know if Rita Webb is here in this audience, but she worked hard on this at NASW National for years. And these things were being gutted all over. Anything that didn't, require kind of a legislation, that administration was just handling differently because they had different cultural contexts or values, like the red state, blue state values, or social work values relative to other disciplines. So we're in the external space here, you all, working with many different groups, with lobbying aside people that are doing all kinds of different things here in DC. And we don't control the agenda. The agenda is controlled outside of us, external. That makes this work hard. So obviously, we are an essential workforce. During the pandemic, early in the pandemic, there were all these talks about whether we were going to have hazard pay. And the association was working very hard to make sure that the bills included social work. And what's so hard about that is that we work in so many different spaces with different scopes of practice, with different funding, coming out of different federal agencies. And we were finding that we were included in some bills, subsets of us were not included in others, and we were trying to get it all remedied. But one of the great things that we had going for us is that we were listed as an essential workforce with the Department of Homeland Security. Interestingly, that wasn't the case for all health providers. So some health providers were actually lobbying Congress to try to get added to that list because they weren't included in any of this encompassing legislation. Now, hazard pay didn't come to be, but a lot of other things did, making sure that you all had PPE, making sure that you could quickly transition to telehealth, to provide teleservices. Now, what was really hard about that was that we were trying to advocate that social workers need to provide in-person services, and they need PPE, and they also need telehealth. Well, that's confusing to members of Congress, so I'm trying to give you a sense of kind of what we had to work through. I want to reinforce that we are essential in policy and that we are guided by this code of ethics, and that really differentiates us from other providers, especially in the macro practice space. We can say that we really are looking out for the best interests of our clients, for people who are vulnerable or underserved. And for those of you that feel like you want to work in policy and you feel intimidated or you feel like you're not prepared, you should just do it. We are recognized in these spaces because it's dominated by other disciplines. namely lawyers and people that have a business background or public policy background. Just want to say that we are the largest provider of mental and behavioral health services in the country. We are an increasingly diverse profession, both socioeconomically and racially. I think that the CSWE data on new graduates says that about 46% of new MSW graduates are first generation college graduates. It's a lot higher for Latino and Hispanic graduates and for Black graduates. So we are increasingly diverse, and this is a strength, so we need to let our lawmakers know that. And when I say that, they'll say, well, Sarah Butts, how are you doing that? Because they're trying to figure out how to recruit a diverse workforce in these among other providers. And I'm like, well, you know, because social workers do this work because it's in our heart, it's in our soul, what Angelo said earlier. We have obviously clinical and also policy practice. We're always trying to facilitate understanding about all of this. There are 5 social workers in Congress. We are leaders across DC. Many of the big coalitions have social workers in them, leading them. Just at the Poor People's Campaign March last week, Debbie Weinstein is a social worker who is the executive director of the Coalition on Human Needs, actually marched with NASW with myself and Dr. Mclean and our president, Mitt Joyner. These are our 5 social workers in Congress. It's Senator Debbie Stabenow, Senator Kirsten Sinema, Representative Barbara Lee, Representative Karen Bass, and Representative Sylvia Garcia. I'm not aware of another mental health provider group that has this many members in Congress. And I can say that all 5 of these champions have either introduced or already drafted legislation that advances our profession, our workforce specifically. It does make a difference, you all, having representation. And sometimes we don't like everything that they do because they are representing their constituents. And I have to work very closely with chapters sometimes around some of these issues. But what's the alternative? Maybe somebody might get elected that doesn't support anything that we want to advance. So we have to keep, we have to remember all these contexts that I talked about earlier. We have to remember that. We're very grateful for these folks, and they help us, they assist us in doing the work that we do here in DC. NASW's policy priorities are outlined in the 2021 Blueprint of Federal Social Policy Priorities. There's 21 issue areas there, you all, covering workforce across all these different settings and a whole robust array of social justice issues that literally range from infancy, the whole life course, to death. I don't know of any other DC-based organization that has a policy portfolio this huge. And what you need to do for policy practice is it's detailed work. I mean, there are staffers like me that in other organizations to just work on one bill, for example. So our portfolio is huge, which means that we need to have grace with one another because we're trying to change the world. I came into this profession to change the world. I know you all did too, either at the client level or at the societal, macro level. But that's not easy to do, okay? I just want to say that we included the grand challenges of social work in this blueprint. That's part of how it's organized. There are obviously additional areas, and it was endorsed by the American Academy of Social Work and Social Welfare, which is an honorific society for our profession, which we should all aspire to be fellows of the Academy as practitioners one day, and their mission is to inform Congress. So our job should be that we make sure that our Academy recognizes the best and brightest in the profession and gets a DC office one day. And so they are the experts. Some of them are among us probably here today. And this allowed us to get the whole profession, because of our structure, that's challenging, on the same page with a shared policy agenda that we could advance together. And I'll say more about that as we kind of go into this presentation. These are the grand challenges if you are not aware of them or haven't seen them. And the reason why they matter, you all, is because social work is misunderstood. Not only do we practice in all of these spaces, do we work on these wicked problems, but we have research and interventions that can be scaled to solve them. Reverend Barber said, America needs social work. This is what we have to contribute. But no one knows we have it to contribute if we don't tell them. So, yes, we can't solve these problems in 10 years by ourselves. This requires political will, interdisciplinary collaboration. It requires resources. Reverend Barber also said that. We need the resources. We know what to do. But we should be trying to advance these recommendations. Child development accounts are one example of a scalable intervention that you see listed there, and that's under the financial capability for all. And that intervention is that each child in the United States would be born with a bank account, along with their Social Security card and their birth certificate, and that you could get contributions into the bank account from foundations or government, and that over time that account would grow. And what's amazing about that research is that it shows that recipients of those accounts, young people, have hope about their educational attainment if they have an account, even when they have very modest amount of money in the account. And it is, you all, a mechanism for reparations. Because then foundations could give money to accounts that fund young people. So there's many other interventions, but I'm just trying to say, we have solutions. We just need the political will and the dollars to get them implemented. So our advocacy is really falls in these 4 categories, and I just want to differentiate them. Regulatory advocacy, and our practice team at the NASW National Office does a lot of this work around practice and submitting comments and making sure that the workforce is protected. And shout out to Miriam Coleman and her team for the work they do in this. Two examples of that are the Medicare physician fee schedule comments that come out through CMS. We respond when there are opportunities. When the Department of Education was considering changes to the public service loan forgiveness program, we wrote several sets of comments. Those comments let the federal agencies know this is what we need to keep going. This is what will help social workers. If it's only other workforces that are providing comments, then the changes in policy generally would serve those other workforces. Most of us are familiar with legislation. I'm going to talk about how legislation is developed in Congress. We do have 5 social workers there that help us to advance it, but they're not our only champions, and we do need bipartisan support. Then there's executive branch advocacy. We have met with the White House several times in the time that I've been at the association. There's a long history of that. And recently there's been a lot of engagement directly with the White House online via Zoom meetings that NASW has been invited to. And then there's judicial advocacy. This is really focused on the courts. There's a lot more activity on this during the Trump administration when there was all these appointment of judges. You have to work in coalition to do this work. That's critical. NASW National participates in over 60 coalitions. Our chapters are all participating in coalitions. And I just want to emphasize that to be collegial in this work, there are certain coalitions that lead in the work. So on some social justice issues, for example, you may have a coalition really being the lead, and we're the support. In the mental health liaison group, for example, that's a large coalition of mental and behavioral health providers. We have a much louder voice because we're like a giant. I sit on the board of that coalition. That gives NASW more leverage. And recently, the American Academy of Social Work and Social Welfare joined the MHLG. That's a big mark in the history of that organization and getting closer to having more impact and translating research, social work research, to policy and practice. The Coalition on Human Needs is another big one, and the Leadership Conference on Civil and Human Rights. We as a profession need to be as closely tied to these coalitions as we can. And just to give you a sense, when something happens, like this, very encouraging that we got a vote on this gun violence legislation last night, and that it's passed, at least in the Senate side, even if it's not a perfect bill. The coalitions might convene and say, okay, we think there's some problems with these provisions. We're going to use this language and not that language, and we're not going to say anything until 5 p.m. on Wednesday. We can't then get out in front of them because then that's not collegial. So there's all this, maybe it's written somewhere, but there's all these unwritten rules, and you learn about this if you ever work in government. There's a ton of unwritten rules in government, and it helps you to navigate these policy spaces. But be assured that NASW is actively participating like as Angelo said, behind the scenes, we just can't always talk about it. Leadership at NASW went to the White House during the Trump administration to meet with them on Medicare, to try to increase the reimbursement rate and scope of practice of social workers. We probably would have loved to tweet out that picture at the time, but we were advised not to do that. So I'm just trying to give you a sense of how this works, and try to not have be encouraged, be optimistic, just assume that we are doing this work and ask us questions. We'll be glad to answer. So our advocacy portfolio is huge, you all. These are the basic workforce advocacy items that we work on. We're tirelessly doing this at the federal level and also at the state level. I'll talk more about this in the presentation. I just have these listed. They're all detailed in the blueprint of federal social policy priorities. And this is a short list of our social justice priorities. As I said, there's 40 pages in the blueprint. In Washington, D.C., if it's helpful to know, these issues are kind of in buckets. And that's how you figure out who you're going to work with on each issue. And so if we don't use the language that they use here in D.C., that Hill offices can understand the way that their staff are organized, it's very confusing. So there's a little bit of a translation between how we understand our issues and how we have to work and convey and communicate them on the policy side. So sometimes folks will write to me and say, Sarah Butts, why does the website say this and this and this and look like this, and I understand it to be this? Well, it's because we're trying to facilitate influence here. And we may be using different kind of language or write our issue briefs a certain way to facilitate that. I want to talk a little bit about kind of the current context in which we're working right now, and just to say, this has just been an extraordinary time. I mean, I personally didn't think it could get any more difficult than when we were in the tail end of the Trump administration. We had an insurrection on the Capitol. Biden came in with a friendly administration. We were having a once in 100-year global pandemic with a workforce in about 100 different settings. We had personal and professional losses during this period. I mean, it's just been unbelievable. Assaults on LGBTQ rights targeting kids at states. And so what I want to try to help, all that is context, but I want to try to help you understand how we decide what we're going to work on. So the president announced a historic investment in mental health and behavioral health. The budget and the associated press release outlines things that NASW has been recommending for probably 30 or 40 years. Parity in Medicare. When the parity law was passed years ago in the Senate, over 10 years ago now, Medicare wasn't required to be compliant. So that has an influence on the whole commercial market. So this is huge for us, and that means that this is our opportunity to try to advance our agenda on the mental health and behavioral health reimbursement, that workforce slide that I put up. This is our opportunity because it's being signaled by we have support from the president. So if somebody writes to me and says, why are you not working on homelessness today? It might be because something's happening where there's an opportunity. You get these windows and you have to act quickly. So some of the key developments that I'm hitting the wrong button. Some of the key developments that happen around this time is that the budget came out in March. The Senate Finance Committee so both chambers of Congress had already indicated that they're going to work on a mental health package, which means that anyone in D.C. that has bills that regard mental or behavioral health is going to try to get support for the provisions of those bills and get them tucked into those packages. And during the pandemic, that was happening a lot. There were huge relief packages, and we were doing all we could to get support for our provisions and to get them tucked in. Everybody was. It's like a big competition. Senate Finance had actually drafted a report in response to a comment request, which NASW submitted over 3 sets of comments to try to influence their decision-making on making sure to include social work bills in that package. So they released the report. Then the Senate Finance Committee held hearings on mental health where some of our priority legislation was actually mentioned by Senator Stabenow, a social worker in Congress. And the GAO also issued a complimentary report. So all of these are signals, and we're looking for Is our stuff there? Are our provisions there? Is this going to help us? And in each juncture, we're having to evaluate sometimes hundreds of pages of like legal documents that require interpretation from attorneys. So you can appreciate why it's hard, right? I'm just trying to kind of help you understand kind of what is actually happening. At the same time, there's unbelievable pressure because we're warriors for social justice. We can't stand the injustice in our society and how unfair it is. And so when we have issues like this, like we have mass shootings, we have problems with gun control, we can't seem to prevent this violence, it's being blamed on mental health or mental illness, we can't pass voting rights legislation, we can't pass the Equality Act, the Senate seems to not be acting at all. And the advocate community is trying to figure out, well, what are we gonna do? And you're either invited or not. I can't tell you how many meetings there are. And it's important if you miss the meeting, you don't know what's happening. So it's a lot of volume and quick activity, and then things change the next day. I think as of last week, we were expecting 13 opinions from the Supreme Court which regard issues that we care about. Sometimes NASW doesn't respond and react to some of those things because an analysis is required. Because it's easy to step in it if you make a mistake. So, again, giving you a sense, I'm encouraged by the Senate passing this bill. I know it's not a perfect bill, but it's a sign that we're going to try to work together. So I want to give you some idea about congressional legislation and how it's developed and what the association's role is at the federal level. And bills come to be in different ways. So first of all, sometimes it might take a couple years to draft legislation. And sometimes associations spearhead the development of the legislation, meaning they've paid attorneys probably to draft it, or they've done a lot of homework to kind of get to the point of having bill text. They might shop that around to members. In other cases, constituents, like all of you, write to your lawmakers, you say what your experiences are, and they get an idea for a bill that you suggest, or that your colleagues suggest, and they figure out who the stakeholders are, and if they have a good relationship, they write to the stakeholders confidentially and say, what do you think of this bill text? If they trust you, they let you write it. Well, how powerful would it be if we had bills in all of the grand challenges for social work? What if we had a bill for every social worker in every practice setting? And the value of that is that so you have the bill already introduced, so it could move by itself, which is unlikely. It usually takes about 10 years for a single proposal to pass. But you have the provisions that's already set up. You have a plan, and you've already garnered some support, and it's ready to be tucked into a package. If there's not a bill in Congress, and we have a creative idea, and we think it's just going to be tucked into a package here, that is not going to happen, y'all. There has to be provisions already drafted that you can point the member to and say, no, this is already a developed idea and concept, and this is what we think you could do. And then on all the list of priorities, they have to decide that that's their highest and best use of resources. I went into a meeting one time, I'll tell you a quick story, where I had just studied all of the student loan debt data for our workforce, and I was really ready to make the case for increasing our salary and at least our reimbursement rates. But I was going to make the case that we need investment in our profession in other ways. And the lawmakers in the meeting start talking about lowering the age of eligibility for Medicare to 55. And that just blew all my recommendations out of the water. Because that's a greater gain. There's a reward there. There's a return. Because then we can cover more people have access to health care. So, it can seem when we're in the social work silo, like, why aren't they the most important? But the truth is, in DC, you have to lobby, whether you're lobbying for a workforce or the homeless or for the gas and oil industry or the wine industry. We all are in the same situation. Here's some bills that NASW has helped to develop that have been introduced in Congress, except for this climate change bill, which is still in a draft form. The Protecting Social Workers and Health Professionals from Workplace Violence Act would provide funding through grants for greater safety measures for social workers and other health providers. Loan forgiveness, student loan forgiveness. Right now, there's been a complete changes to the public service loan forgiveness program, which I'll talk about briefly later. But one of the reasons that some social workers and other public service professionals may not qualify is that they completed their 10 years of service in a qualifying nonprofit or public service employer and now find themselves not working for a qualifying employer. This bill would change that. So we helped with this and helped to draft it, and one thing that's crazy is they wanted to communicate, the office wanted to communicate that these are career changers. I'm like, no, we haven't changed careers. We just changed employers. We need to make this program, the Public Service Loan Forgiveness Program, contingent on public service and not the tax status of the employer. So that's the value, is that you're educating these offices and that they in turn can help us. We do have a bill on climate change that we've developed in coalition with many other individuals and experts that would essentially fund community-based responses. I think this is a mechanism, you all, to find a way to bill for addressing social determinants of health. Our experts are saying that the climate crisis is among us and that we're going to see layered disasters that disrupt our everyday life, that we can't get to work, or that schools are closed, or that entire neighborhoods are having to evacuate, and there's going to be devastating mental health impacts. Our workforce, we're not prepared to handle this. Not the whole entire behavioral health workforce isn't, because the structure of reimbursement doesn't allow for community-based, community-involved, community-driven or led responses. And NASW is at the table leading the development of that. We have a bill on integrated care that would allow us to practice in the collaborative care model and to have those positions initially funded through legislation. We serve two roles in this model, as an LCSWC consultant and also as a behavioral health care manager. If we can get integrated care in primary care offices, we can prevent really severe behavioral health problems. We're closer to having more access to coverage and services, and we work with other groups like American Psychiatric, to get that bill introduced. So I'm hopeful that we can get support for that through these packages. That's one of the ones that the provisions could be included. We have a bill on school-based social work that would fund school-based social workers in addition to a technical assistance center and evaluation of school-based social work, because there's not a standardized scope in school-based social work. And what clinical social workers do providing psychotherapy is not the same as what those social workers are doing in the schools, and we have to convey that. So this is a wonderful bill. I think there's a chance we could get provisions included. Again, we all need to write to our lawmakers and say, advance these bills through these packages. And there's one in differential response in policing that would allow for social workers to act as first responders. And I want to say something about this. One of our colleagues, Michael Sheridan, is the founding director of the Center for Social Development at WashU Brown School, and he would say, we should be thinking about a new institution for public problem solving. What if they send social workers when a baseball goes through a windshield? Like, we have to get out of our mind what we understand police or crisis response to be and step in to where there's something positive. We're very good, you all, at problem identification. We need to focus our powers on where the solutions are. And this is something that there's interest in this. I was on NPR on behalf of the association talking about the alternative response in policing. We did alternative response in child welfare. We've already kind of talked about this Improving Access to Mental Health Act, but we need to get this support for this bill. We have the most sponsors that we've ever had in the probably 8+ years that we've been working on this. We're paid 75% of the physician fee schedule in Medicare. Psychologists are paid 100%. For psychotherapy, almost the identical service. And that's holding us back because that's setting a kind of low bar for what commercial insurances provide, and we're not operating at our full scope of practice. In fact, our scope and reimbursement hasn't been reevaluated since 1989. Yeah, and I think the key barrier here is budget. It's going to be expensive. I think likely, I don't want to guess how much time, but I think other providers will be admitted to provide services in Medicare, and that's going to be a good thing, you all. So counselors and others will eventually be able to practice in Medicare, and we want the full continuum of services, including substance use disorder services, to be covered in Medicare. There is enough need for all of us. But we're not going to get our interest advanced unless we make some noise. Because if we sit by, we will not, this just could stay the way it is if it's good enough as it is. We should demand that CMS tell us how many social workers are participating in the Medicare program, how many people are actually receiving these services, because we suspect that they're not accessible. And that's just not acceptable. Our older adults deserve more, and that's the kind of advocacy that we need to do. I want to give you some hints. So I just told you all about these bills, which is kind of taboo to do. In DC, you wouldn't, I'm speaking about this to you all because we're talking about what we're contributing as a profession and how we can increase our impact. There are hints in communications about who's championed legislation. So if you see in press releases that Dr. Mclean or one of our NASW chapters or one of our directors at National is quoted in a press release, it's likely that we really worked on that legislation. We did a ton of work behind the scenes and we're being acknowledged. Likewise, if there's another group that really champions something, say the nurses, we might not see our quotes there, but we might be an endorsing organization, invited as an endorsing organization. When we're mentioned, we're almost always involved. That's part of the value of investing in government relations work and doing this work, because that's how it's reciprocated. So what we've been trying to do is get all the social work organizations invited to endorse these bills, and then you see them listed. So that's how we take the whole profession forward. If don't just put NASW, put CSWE, put NABSW, put the School Social Work Association. Why not? We have to collectively advocate for social workers. I looked on the internet last night, and I don't know exactly the numbers, but I think there's over 3 million teachers. And I think there's between 3.8, maybe 4.2, something like that, nurses in the United States. And that doesn't include all the, outside of the RN, all this, the nurse practitioners, there's probably even more. There's 700,000 of us. Only 110,000 of us are members of NASW. When members say, well, why don't we have what the teachers have? There are a lot more of them. That means we have to be louder, more involved, more engaged, and I know we're exhausted, but I'm just trying to explain, this is the context in which we're working. Sometimes I get calls from members and they say, why aren't you supporting this bill? And I want to say, we helped write that bill. I can't do that. I can't do that. And the chapters, they know too, because they do this at the state level. This was a cool thing that happened. So in student loan debt, in the beginning of the administration, there was a big focus on cancellation, broad-based cancellation for anyone with student debt, not just social workers. And we became very involved in this. And you'll see that I was quoted in 5 or 6 press releases, one of which was retweeted by Senator Elizabeth Warren. I mean, how cool is that? And so this campaign went from 235 supporters to 415 plus organizations. We haven't given up on cancellation, but I'm trying to give you the hints. Things you can look for on social media that are an indicator. Things you can look for in these press releases, because we can't talk about these things publicly. These are 2 things, one thing I'm really proud of. Our colleagues in the Grand Challenges, so this is something else about the Grand Challenges. It gives us a mechanism to collaborate across universities and across organizations that is centered on impact and not accolades or it's not competitive. It's about the impact. And so we work with the Grand Challenges group on economic inequality to develop a letter asking Congress to make the child tax credit permanent and fully refundable. We sent a letter with over 800 or 900 signatures of social workers across the country, and Politico published it. We should just do that every day. I'm serious. I mean, we have to coordinate because you have to have the policy knowledge of what's happening and then also the expertise to write the letter. So it's got to be a collaboration between experts, academic experts likely, and policy practitioner experts, because we're experts too. Okay? We're experts too. That's why I want to see you inducted into the academy. Politico also pulled of a press release where I was quoted on paid leave. We were using the argument that this is a mechanism to help people to get substance use disorder care and treatment. That they don't have paid leave. Our clients can't afford to go because they're going to lose their job. And our quote was picked up because Politico thought it was the most compelling. Recently, Dr. Mclean, working with our CEOs of American Psychiatric and American Psychological, we all worked together. We got our government relations departments together, and we quickly wrote this letter called No More, calling Congress to act on gun violence. It was a paid ad. It was expensive. It was published. It got media attention. We got a bill through last night. I know we don't like to think about money in politics, but they're not just going to publish it because it's the right thing to do. That quote I had in the beginning of the slides, what is right and what's wrong is wrong. I wish everybody else kind of thought like that. But this is the world that we're living in, and this is how you have influence. Now, the really connected advocacy organizations that are issue-specific, they're able to get press to cover the letters that we sign on to. So we had some letters where we got national sign-on and all 50 chapters on loan cancellation, and they were being covered by MSNBC and everyone else in media. We just have to keep on doing that. We have to make sure that there's policy practitioners on behalf of our workforce and our profession doing this. We host congressional briefings at National. This is one I'm proud of because all the social work organizations signed on to it, including NASW. We have to work collectively, and we don't all have capacity. It's hard to compete with some of the giants in Washington, D.C., but there's this process where we have to onboard our own profession before we can make any progress. It's kind of like, listen, you all, if Sarah Butts or anyone else from the national office calls you and says, can you support this bill in 2 hours, trust us that this is good for our workforce and our clients because we only have about 2 hours to make a decision sometimes. So we have to facilitate the relationships within the profession and outside, which is tough. We're not all under one umbrella. I believe that we can still make progress and that not hold us back, but it is a consideration. And we can't have an attitude like, I don't want to support that bill because I don't work in a hospital. Or I don't want to support that bill because I'm not an independent clinician. Why are you only advocating for independent clinicians? Sarah Butts, what about the macro social workers? I'm like, you all, I am a macro social worker. We can do the advocacy in these different areas, and we have to all get behind it. If you're interested in looking at what we've recently done, there's a part of our website, this page, that says comments, statements, and sign-on letters. I didn't know this existed before I came to NASW. There's a ton of information there. There's all these sign-on letters. It tells you our positions and everything, and our comments are there, and we would love feedback. If you see comments and there's something we're missing, give us the analysis. You know, information's powerful here in DC, and we don't know everything. Sometimes you all on the ground in practice settings know about these little tiny details that make your work more difficult or expensive or disserve clients or disrupt care, and we need to understand that. And you to help us to give us the language to convey it, and we'll convey it. This is I'm going to go into some examples of policy success. Partnerships are critical. And it's hard to evaluate what is the best thing to do with limited resources and limited time, because we get a lot of invitations. But this invitation that we got from the Legal Action Center was really a wonderful invitation. It's been a wonderful partnership, so I'm going to share about it. We got an email inviting NASW National to participate in a learning collaborative with the Legal Action Center. They were interested in covering substance use disorder services in Medicare. And a little light bulb went off in my head, and I said, okay, we provide substance use disorder services. We are underpaid in Medicare. We are not operating at the highest level of our scope. And I got to get this group and all the learning collaborative folks to support our bill. the Access Bill, the Improving Access to Mental Health Act. And turns out in this group, about 30 organizations, we had a lot of the similar challenges. And LAC facilitated getting all of our recommendations. And we wrote a document, and you can look it up on the internet, and we can provide these slides, there's a ton of links in them. Roadmap to Reform, where this group's recommendations for how to get substance use disorder services, and really mental and behavioral health, y'all, because it's not separate when you're talking about this, okay, to get it covered. The next thing I know, they did 40 or 50 visits on the Hill, lawyers, advocating for what we need. That's what you have to do. You have to recruit other organizations because they expect me to lobby for you all. They expect NASW to go and say we need more money for the workforce. But when it's other groups that are interested in client health and well-being, advocate groups that are really about society and well-being outside of the workforce, that's what's powerful. And this is just an excellent example. And now guess what? They are developing legislation that will include the provisions of our bills. That's what we hope. And that means that we would potentially have a standalone proposal and other proposals that have our provisions in them, that increase our reimbursement and our scope of practice. That's how you get this done. So that's a meeting worth going to. After the insurrection on the Capitol, so I'm going to give you some just quick policy examples. After the insurrection on the Capitol, which was just horrific, a group called the Congressional Management Foundation, they do all the professional development and help Hill offices to manage the office. They're all run like individual businesses. Came to NASW with a group called Pop Vox that helps nonprofits to be effective and said, we think that congressional offices can learn something from social workers. And I said, well, I already know that. You know? We ended up working together and provided, we got social workers appointed to do several webinars with former members of Congress. We developed these worksheets on, what are the safety practices and clinical practices that you can employ, you can put into place right away in a Hill office that helps to treat clients with dignity and respect, and also provide for safety of the staff and the member. Now we have an ongoing partnership, and we've been invited to present, I think, at 3 or 4 different conferences of lawmakers where social workers are presenting on our skill set. And that's powerful, you all. And so it's not just about complaining like those insurrectionists are bad and X, Y, Z. It's like, let's try to use our skill set for something good, for something positive. In the last appropriations process, we got a workforce study included. It's not funded, but it's mandated of several federal agencies because one of the problems with our advocacy is that we don't have great workforce data, and there's a lot of reasons for that. There's so many of us, we're working in these different settings, different scope of practice, not standardized data set nationally, different credentialing and licensure, different titles. This had been in a bill, this concept had been in the bill, the Social Work Reinvestment Act, which we really couldn't get support for. And we had an idea to ask Representative Barbara Lee if she would be interested in submitting this, through an appropriations request, and it was indeed included. And now we're working with a couple federal agencies to include HRSA on how to make some progress in understanding our workforce better. Their projections right now about our workforce are awful, you all, because the data's not good. So, incremental progress. We are developing an interstate compact for the social work profession. There will be a public comment period for model legislation that will need to be passed in all compact participating states. There's going to be a session on this later today after Admiral Levine's presentation, so I'm not going to go into the details of this, but this is going to allow for interstate practice. It's going to allow for continuation of telehealth. It's the National Association of Social Workers that, in partnership with the Association of Social Work Boards and the Clinical Social Work Association, along with the council and state governments, this tremendous organization has made this happen with funding from the Department of Defense. So it won't be perfect. The compact's not going to be perfect, but we can't. It's part of modern society. We're not going to be able to not have one. So it's a good sign of progress. I could talk for 5 hours on student loan debt relief, but here's what I want to tell you. I know about your student loan debt. I know about your kids' student loan debt. I know that you've had to take Parent Plus loans. We've provided services through resources like Savvy to try to help our members. When the Department of Education, when we knew that they were going to have to reform the public service loan forgiveness program, we acted quickly. We worked very closely in coalition to get changes that we wanted to see to that program. When the Department of Education announced those changes, I was one of probably 8 people on a phone call to say, hey, they're going to do it. We were successful. And it was tireless advocacy, and a lot of you all participated in that because we had a campaign to collect stories. The key takeaway message here is that we are working on cancellation. We are working on employer-sponsored student loan debt relief. So there was another provision of a bill that was passed through the CARES Act that allows employers to pay for their employees up to $5,250, not taxable to the employee, for their student loan debt. We hope that becomes permanent, but NASW helped to advocate for the inclusion of that and for the advancement of that bill. So what I'm trying to convey here is it's multifaceted. We're trying to do everything we can to reduce the debt burden on you all. You have to act now for this public service loan forgiveness waiver. And I can't tell you how many social workers I've seen commenting online, and everything that I see that they're saying, I think they qualify, and they're just so discouraged that they're not going to apply for the waiver. So what's happening with the waiver? You can apply for consideration of public service loan forgiveness waiver even if you never applied for the program, ever, in the last 10 years. So starting in 2007 to date, if you have worked for any public service employer, you should fill out the employment certification forms and get those years of employment and associated payments on the record. The administration has said that they will count some time of forbearance for some folks. They will count the time that we have had deferment from COVID for payments. It's possible that after October, they reform this program and they change it and you only need 5 years of public service. But what if they don't count the public service unless you get it certified now? We need to tell every social worker in the country this. The deadline is October 31, 2022. Just about a month ago, Dr. Mclean and I were at the National Association of Deans and Directors meeting, and we met a social worker who had a very large sum of money forgiven. Like over $100,000, you all. There are executive directors in our own association that have not submitted their paperwork. This is a reminder message. So to all of you, submit your paperwork. I understand that Parent Plus loans can also be discharged. You just have to consolidate. So be wise about how you do this. And if you find yourself in the position that you don't qualify because you work at NASW, we're working on that too. Or if you find yourself in a position and you don't qualify, we're not going to give up on an advocacy because it should be predicated on public service and not the tax status of the employer. If you have received forgiveness, please put your stories in here and write with your recommendations because we're going to continue this advocacy. Department of Education has said they'll continue to work with us, with the advocate community, and we need to collect stories. We collected compelling stories. If you're interested, you can go to our letter to DOED asking for the waiver. It's unbelievable. I think there's like 10 pages of stories of social workers and their experiences. So we need to do the same thing now. If you've gotten forgiveness, the change that it's made in your life and why you think that was the fair thing. If you're interested in seeing all that we've asked Congress to do in terms of including provisions of bills that support our workforce and our clients and society, there's links to our comments that we've provided around the mental health package here. And I want to give 2 shout-outs that have to do with our chapters because most of my presentation is centered the federal policy advocacy, but we work like this. We are one association. And the chapters get really in trouble, and they write to the chapter colleagues, and there's a big, long listserv, and they all start offering resources, and when it's really bad, they write to the CEO, or they write to someone in our office at National and say, what do we do now? And they're leading on the state front. I mean, just recently, NASW served as a plaintiff in a court case to protect abortion access in Ohio. And they were successful. They were successful in stopping these limits, And that signaled, this was in partnership with ACLU and Democracy Forward. Democracy Forward also assisted us with some of our PSLF work. These are pro bono attorneys that we're very grateful for their partnership. But this sends a signal that NASW is not going to sit and allow our workforce to be criminalized. That's a big deal. That's a real threat, you all, when we have the kind of things that we're seeing with abortion and gender-affirming care. Criminalizing social work. And so we stood up in Ohio, so shout out to Danielle Smith and the whole full team on that, a win. I have another example. It's a little more grim. It's not as positive. But when Governor Abbott in Texas announced this executive order saying that gender-affirming care is child abuse, it was because they couldn't pass a bill in the legislature there in Texas to do this. And what did that do? That was theoretically going to compel social workers in public child welfare departments to be put into an ethical dilemma. That they're going to report families for helping their kids who are trans to get access to gender-affirming care, to life-saving health care. The NASW Texas chapter quickly wrote a statement. The NASW National Chapter did an analysis as quickly as we could and wrote a statement. In that time, Senate Finance staff had reached out to National, HHS had reached out to National for an emergency call. The government didn't even understand within 3 minutes on social media when this was blowing up what the impact was going to be. We were trying to figure it out, but we were at the table. We were being called upon at the state level and at national. And just a couple of weeks ago, we were invited to a White House meeting on gender-affirming care and health care access in Texas. We can't talk about this stuff out on the social media sphere because it's just taboo. But we are doing the best that we can. We are fighting this fight. And we would all appreciate it if when you're talking to members or you're talking to your colleagues and friends, NASW is indeed doing this work and help to facilitate more understanding of some of this, because I just think there's not a sufficient amount of understanding. So, policy practice. I know we're getting to the end here. NASW and the University of Michigan published this paper, The White House as a Field Placement. It recounts the experience of Harold Richmond, who was a White House Fellow. I don't think there's been a social worker in the White House Fellows program since that time. Dr. Richmond went on to be a dean. He talks about his experiences as a White House Fellow in this paper, and I reflect in the preface on policy practice, along with some other deans in the profession. There's a list of policy fellowships opportunities which are paid in this paper. And what I want to encourage us to do and to think about is that we need internships starting at the macro level, BSW and MSW level, to train policy practitioners, because you can't get into these jobs without experience. We need the schools to do that. And then after those students get out, they can get these paid fellowships, and that's the pipeline into influence. That's what I call it. That's how you get a policy job. That's how you work in a lobby firm. That's how you end up in the federal government or as elected official even. We focus a lot on getting elected, but there's a whole group of individuals that work in the systems that are incredibly influential and powerful. Think of Wendy Sherman, Barbara McCoskey, Jody Olson. There's an equivalent track. It's like tenure is not the only way to be the most senior in your field in academia. There is a very senior policy practice track, and we need to be facilitating that. And so encouraging students and mid-level professionals, even faculty have done some of these fellowships. So I want to give some shout-outs. This is Paige Jones. Paige was an NASW National intern just last year. She went on to secure a Congressional Black Caucus Fellowship. She was assigned to Representative Gregory Meek's office, representative from New York, for 6 months. And then she goes on to be assigned to VP Kamala Harris's office. That's where she is right now. Paige called me up and said, "Sarah, the White House is going to call and ask you for a recommendation." I didn't know it was going to happen in 10 minutes. I was blown away. I didn't have time to process that. But it's very competitive to get these fellowships, but not impossible. Her whole career trajectory will be changed, and we will all benefit by having social workers in these roles. Shout out to Paige. There are other policy practitioners that are on the Hill that reach out to NASW and that we work together. Lucinda Jones is one. This is Kristen. She has a fellowship with Hill Vets. And two others are Robert Wood Johnson Foundation Fellows. Lillian Windsor, there had not been a Robert Wood Johnson Foundation Fellow, Health Policy Fellow in the Senate, I think since the 80s. And now, right after her, another social worker. And Dr. Mclean has been invited, I think, 3 different times and is presented to the Robert Wood Johnson Foundation Fellows, to all the different providers, medical providers, often doctors, sharing the social work perspective. And we have 2 advisors to the White House right now. One, Sarah Gellert, USC, Dean of the School of Social Work there, a health equity expert, is serving in an advisory role. And Lee Westgate, our very own Lee Westgate, Manager of Policy and Advocacy at NASW National Office, is on a stakeholder group around healthcare access. This is the kind of work where you really have impact, you all. And this is just to say we have some social workers in action here. President Joyner, who is very active and involved, and that's Congresswoman Ayanna Pressley, and different meetings. That's one of us at the White House, and that's Robin Golden at the White House. Robin Golden is a fellow of the American Academy of Social Work and Social Welfare. That shows the partnership that we can have, the strength of the profession. Just a few more things I want to say before I close this out, you all. I want to say some comments about systems change. We know that there are calls to defund police, to eliminate policing, to eliminate the public child welfare system. This is challenging for our profession because we work in these systems. We advocate for them to change. We're on the inside and the outside. And I want to make the argument that we should be on the inside and the outside. I've been on the inside the majority of my career, and I've made an impact. I know many other social workers who have. You can facilitate a lot of change if you understand how the systems work. Dr. Bailey said yesterday in the plenary session, you can't change the systems unless you know how they work. You have to work in them to know how they work. So this splintering and fragmentation in our profession and arguing about how to serve clients better, I just want to remind us that we have social workers across the country working in all these settings, and it's not really fair, I don't think, to point to another social work group that's trying to do their best and to say, well, you're not doing good enough over there. Thank you. And I just want to say that we're really good at problem identification, and sometimes we focus too much on that. For example, something terrible happened in Congress or in society in general, and we are outraged. And we want to write a statement that we're outraged yesterday and we're mad. But it's got to be more than that, because if all you ever do is get mad, it's performative. You have to take the other steps. You have to do the hard work. You've got to be in the trenches doing the work. And I'm in the trenches too. It's just policy trenches. And they can be tough. They're not the same as client-facing work. I did that work, and I know how hard it is. I worked in public child welfare. I came up in the child welfare system because I wanted to understand how this system is treating our most vulnerable people in society. And it wasn't always good. But we can't just abandon a system to build a new system that will eventually have flaws. So we have to participate in the greater kind of discussion about how to make these changes. And I just wanted to emphasize that I think these things are important. Sometimes it feels like social workers just want to see that we've expressed our outrage. We have to do more than outrage, y'all. And I'm not suggesting that we're not in it and that we're not doing these things, but that's how you really have change. That list of grand challenges, we have meaningful things to contribute. I went to Victor Manolo's presentation yesterday. I don't know if he's in the room, the California chapter president yesterday, and he said when you want to convince lawmakers to come to an event or to listen to you, you have to give them the hook. That's our hook, those grand challenges. We are doing more than removing children at CPS. So just burning down the system is probably not going to be what's best for us, and I just want to kind of emphasize that. And it makes other people looking in and say, what are they doing? You know, they're working in a system and they want to eliminate it, and so we have to be careful to have some of these conversations internal in the profession. This is my opinion, but I don't like to see the divide among social workers. I think we need to really focus on our strengths. It's part of our code. So we don't always talk about this in policy presentation, but it's important. NASW has a PAC, a political action committee, which means that we can fund candidates or members of Congress. And I just want to kind of share that we also have 43 state PACs. We are, to my knowledge, the only PAC for the social work profession. What is the difference between work that you're doing on the Hill and the PAC work? Well, on the PAC side, you make a financial contribution. It's usually between, at the federal level, $1,500 and $2,500, and you get to go to a meeting with the lawmaker, usually with about 8 to 10 other people. You don't usually talk about legislation there because that's kind of taboo. You thank the member for all the things that they've done, or you express concerns, or you share what you're seeing on the ground. When there's thousands of bills introduced in each Congress, or hundreds at least, it's a way to remind a lawmaker of our workforce when you show up at these PAC events. And that's the money part in DC. Sometimes if you go to the PAC events, there's 3 or 4 nursing groups in one PAC event. Why? Because there's millions of them. There's money in politics, you all. You got to pay to get your letter published, and you got to pay to go to these PAC events. Guess what? You can't contribute to the PAC unless you're a member of NASW. If you want to know why we're not having the outcomes and the impact we want to see, these are part of the reasons. It's on us, it's incumbent on us to lead our professional associations in a way that we can have collective impact. Some of the other things that NASW's PAC does, which I haven't found a PAC yet that does this, is they fund field organizers for the upcoming elections because voting matters. That's the only way we're going to get change. And we have field organizers will be placed, NASW field organizers in Arizona, in Colorado, in Georgia, in Pennsylvania, in Wisconsin. Our chapter EDs will supervise these individuals, and we'll hope to have, mobilize people to vote. That's how we use that money. So just want to say that we're stronger together. I'm a member of many of these organizations. We need to find a way to work collectively. Many of us are on boards of these organizations. And I think that's the job of the next generation, is to figure out how we can have impact. Not all these organizations can lobby. But some of them point to NASW and say, why aren't we lobbying? Why aren't we advocating? And we rely on membership and support from you all to do that. That's the only way we're going to get kind of the as Barbara says, that so America needs social work. I'm giving you the pathways. So ask you to join us. Join us at NASW. Thank you for being here today. And please participate in this voting campaign for voting as social work. They are doing this campaign, the Power of 3. I'm going to end my remarks this way. If we all, 700,000 social workers, registered 3 people to vote, we could have a difference. We could make a difference with the same message that Dr. Barber gave us yesterday. We can't give up. So thank you. Thank you all.
Wonderful. That's a lot of work. That's a lot of work you're doing. We got time for a few questions.
Okay, all right. Well, I just learned we have time for a few questions. So we have some mics here on either side of the room and in the center here. We have plenty of chapters here. So if there are If there are things that you want to share about the questions or, no question too big or too small. Yes.
Hi, Sarah. Thank you. My name is Joel Rubin. I'm the Executive Director of the NASW Illinois Chapter. So, thank you, Illinois participants. I just want to say thank you to Sarah. There are many chapter execs here. There are many chapter presidents and presidents-elect. And since you've been with the association, it's been really significant. And I want to implore everyone, the message that Sarah said, many of us work tirelessly in our states for all the things that are related to what Sarah said. If you're here today at the conference, just join us. We need you. We need you to work on all these important issues. Many of us individually were up at the Hill yesterday or on Tuesday meeting with, or whatever day it is, I can't know what day it is anymore. So this is a request that, and I know this was first conference back together in a couple of years, but next time we get together collectively, let's try to all have a day, half a day, to go up to the Hill. Folks,
You got it.
There are no shortage of issues. So, but Sarah, thank you so much for, on behalf of all the I think I can speak for all my colleagues and all the chapter presidents and chapter president-elects, so thank you.
Thank you, Joel. Yes.
Hi, my name is Grace Jenkins. I'm currently a BSW student at Florida Atlantic University. So I'm kind of very new to everything, I guess. I have been very interested recently in policy, and it was amazing to hear your talk. It's been something I've been trying to research more of, like how to get involved with social work policy, and this was a very good, just straightforward, easy way to understand kind of what social workers are doing in policy. And so, yeah, I've just been spending like the past couple months like emailing anyone I could at my school, like around, to see how I as a student could be involved in this. I mean, like when the pandemic started, I wasn't even old enough to vote, so I'm very, very new to everything. So I was just kind of wondering how you started in policy, how you got involved, and like how, I guess, you started after graduating and all of that.
Thank you. Well, I'm encouraged by hearing your interest. And I studied political science and social work in my undergrad. I thought I was going to be an attorney, and I ended up going to social work and never turning back. And I started in public child welfare. I started first in clinical work in foster care, and then I interned for the executive director of the Social Services Administration in Maryland, who was charged with overseeing 24 local departments of social services. So I spent 4 or 5 years in government, state government, working for political appointees. Then I went to the city level and worked for appointees at the mayoral level in a nonprofit there. So you need field experiences to do policy work and just advocate for yourself. And macro social workers will probably be glad to speak with you, and I'd be glad to speak with you.
Thank you.
Hello, thank you, Sarah. I'm the other Dr. Gary Bailey. But what I would like to see, I did my research on leadership studies, and what I haven't seen and I would love to see is more investment dollars in research, so that in leadership, I don't know if you all noticed there was a leadership thing going here with these young kids that were going around. They said pro-life. Did anybody talk with any of those people and to find out what they're pro-life? Because we do advocate for, the gun control is pro-life. Vaccinations is pro-life. Longer life is pro-life in healthcare. And I think we need to get with younger populations, and actually being a 68-year-old person that attained his PhD, we need to combat ageism, and we need to get people involved of all across spectrums. And lastly, I when I was doing my research, I found some other social work organizations like the Society of Social Work Leaders in Healthcare. We need to get more investment in leadership research dollars in education and other things, and I'd like to see us more involved, and I'm through.
Hello, Sarah.
Hi.
My name is Gwendolyn Richard, and I'm from California. I'm a clinical social worker there. And my question is, you made a comment in your presentation that it would be good, maybe even effective, for us, all of us social workers, to write in on some of these bills.
Yes.
But I don't know sort of the avenue for doing it that would be the most effective way for us to do it.
I
We
have
need
the
to know
way.
that.
I have a list. We have a list. We have action alerts at NASW National, and I actually already have it pre-drafted to send as a follow-up to this conference. So we try our best to facilitate that, and it's easy, and it tells you who to send it to. But I do want to say, sometimes social workers are intimidated by this. They want to hear from you as a constituent, and you have the knowledge. I'll give you the bill names, but you have the knowledge to convey what we need. So be confident with that, and thank you. Thank you for your willingness to step up. We need that.
Hi, Sarah. My name is Dr. Jessica Hare.
Hi.
And I just want to promote that Sarah, myself, and Dr. Charles Lewis, CEO Chris, we are hosting a national call on Monday night at 7 p.m. Eastern, promoting political social work, which is not a very widely talked about subject. So if you all would like to register, you can visit americanpromise.net and register for this virtual webinar. And thank you, Sarah, for being on that with me.
I did not know that you were here, and I hope to connect with you. I'm very glad to see you. Thank you.
We're going to ask President Joyner to come up. Thank you, everyone.
Thank you.